NHA CCMA Practice Test 4. Question 1. According to Maslow's theory of human behavior, self-actualization is considered the highest category of need. What is considered the second highest category? Option A, esteem. Option B, safety. Option C, belonging. Option D, physiological. The correct answer is option A, esteem. Esteem needs include the need for respect and status and follow the fulfillment of social needs. Question 2. Which of the following is not a violation of the Health Insurance Portability and Accountability Act? Option A, talking about a patient condition during shift change at the nursing desk. Option B, leaving a computer screen with patient data visible to the public. Option C, discussing a patient diagnosis with a friend. Option D is selling patient data to a marketing firm. The correct answer is option A, talking about a patient condition during shift change at the nursing desk. Professional communication between healthcare workers for the purpose of care coordination is permitted. Question 3. When a medical provider asks a patient a question that requires a detailed response, what type of question is he or she asking? Option A, open. Option B, direct. Option C, leading. Option D, closed. The correct answer is option A, open. Open-ended questions encourage the patient to provide more information than a simple yes or no answer. Question 4. A person who denies the presence of a negative behavior and blames it on someone else is using what type of defense mechanism? Option A, projection. Option B, the denial. Option C, rationalization. Option D, regression. The correct answer is option A, projection. Projection involves attributing one's own unacceptable thoughts or behaviors to another person. Question 5. Which level of Maslow's theory of human behavior entails the basic needs for food and water and sleep? Option A, physiological. Option B, safety. Option C, social. Option D, esteem. The correct answer is option A, physiological. Physiological needs are the most basic requirements for human survival. Question 6. When speaking to someone whose native language is not English, which of the following would not be helpful in communication? Option A, writing the instructions. Option B, using an interpreter. Option C, using simple words. Option D, demonstrating with gestures. The correct answer is option A, writing the instructions. If a patient has a language barrier, written instructions in English may be just as confusing as spoken English. Question 7. A child who is first starting to roll over onto his or her abdomen is likely what age? Option A, 4 to 6 months. Option B, 1 to 2 months. Option C, 8 to 10 months. Option D, 12 to 14 months. The correct answer is option A, 4 to 6 months. Rolling over is a developmental milestone typically achieved between 4 and 6 months of age. Question 8. What is the most common first sign of puberty in males? Option A, enlargement of the testes. Option B, growth of facial hair. Option C, deepening of the voice. Option D, acne. The correct answer is option A, enlargement of the testes. Testicular enlargement is typically the first physical change noted at the onset of male puberty. Question 9. Which of the following would not facilitate communication with a geriatric patient? Option A, keeping the voice low. Option B, maintaining eye contact. Option C, eliminating background noise. Option D is speaking clearly and slowly. The correct answer is option A, keeping the voice low. Many geriatric patients have hearing loss and a low voice may be difficult for them to hear. Question 10. Which of the following is within the medical assistant scope of practice? Option A, taking a patient's vital signs. Option B, prescribing medication. Option C, performing surgery. Option D, diagnosing a condition. The correct answer is option A, taking a patient's vital signs. Medical assistants are trained to perform clinical tasks like measuring blood pressure and pulse. Question 11. What is the most important piece of information to obtain from a patient when taking a message for a physician? Option A, a name. Option B, address. Option C, insurance ID. Option D, a date of birth. The correct answer is option A, name. The patient's name is the primary identifier needed to ensure the message is attached to the correct record. Question 12. Typically, a male physician examining a female patient should bring which of the following into the examination room? Option A, chaperone. Option B, another physician. Option C, the office manager. Option D, a family member. The correct answer is option A, chaperone. A chaperone provides professional protection and comfort for both the patient and the physician. Question 13. According to Maslow's theory of human behavior, which levels need to be fulfilled before progressing to social needs? Option A, safety and physiological. Option B, esteem and safety. Option C, self-actualization and esteem. Option D, physiological and esteem. The correct answer is option A, safety and physiological. The hierarchy requires that basic survival and security needs be met before an individual seeks social connection. Question 14. When is it most appropriate to wash your hands when examining a patient? Option A, before and after examining the patient. Option B, only before examining the patient. Option C, only after examining the patient. Option D, only if you touch body fluids. The correct answer is option A, before and after examining the patient. Hand hygiene must be performed both before and after patient contact to prevent the spread of infection. Question 15. A medical assistant who is pro-life notices a history of an elective abortion on a patient chart. Which of the following is the most appropriate action? Option A, inquire if the patient had any post-procedure complications. Option B, ask the patient why she had the procedure. Option C, express personal disapproval to the patient. Option D, tell the patient to find a different clinic. The correct answer is option A, inquire if the patient had any post-procedure complications. A medical assistant must remain professional and focus only on the clinical care and health of the patient. Question 16. A medical assistant notices an urgent message needs a return call and paperwork needs filing and a patient is at the desk and a lab tray needs setup. Which task should be completed first? Option A, addressing the telephone message. Option B, filing paperwork. Option C, setting up the lab tray. Option D, cleaning the office. The correct answer is option A, addressing the telephone message. Urgent clinical communication takes priority over administrative tasks and future preparations. Question 17. A devoutly religious woman requests that she not be examined by a male medical assistant or physician. Which of the following is the most appropriate response? Option A, have a female medical assistant and physician see the patient. Option B, tell the patient that sex does not matter in medicine. Option C, ask the patient to leave the office. Option D, ignore the request and proceed with the male doctor. The correct answer is option A, have a female medical assistant and physician see the patient. Respecting a patient cultural or religious modesty is an important part of patient-centered care. Question 18. According to Maslow's theory of human behavior, which of the following should be fulfilled before progressing to safety needs? Option A, shelter. Option B, self-esteem. Option C, a friendship. Option D, personal growth. The correct answer is option A, shelter. Shelter is a physiological need that must be addressed before an individual can focus on safety. Question 19. Which of the following mannerisms would be least likely to be considered hostile or aggressive? Option A, low voice. Option B, a screaming. Option C, pointing fingers. Option D, crossing arms. The correct answer is option A, low voice. A common low voice is generally perceived as non-threatening. Question 20. Which of the following would not aid a visually impaired patient? Option A, speaking in a loud voice. Option B, announcing your presence. Option C, describing the room layout. Option D, offering your arm for guidance. The correct answer is option A, speaking in a loud voice. Visual impairment does not necessarily mean the patient has hearing loss, so a loud voice is often unnecessary and rude. Question 21. A child who is starting to walk without assistance is most likely what age? Option A, 12 months. Option B, 6 months. Option C, 18 months. Option D, 24 months. The correct answer is option A, 12 months. While development varies, walking independently usually occurs around the first birthday. Question 22. A patient has stage 4 breast cancer and her son offers the physician anything to save her life. What stage of grief is this? Option A, bargaining. Option B, denial. Option C, anger. Option D, depression. The correct answer is option A, bargaining. Bargaining involves attempting to negotiate for a different outcome in the face of loss. Question 23. Which of the following is true regarding the Genetic Information Non-Discrimination Act of 2008? Option A. It prevents insurers from discriminating based on genetic information. Option B. It allows employers to fire people with genetic risks. Option C. It mandates genetic testing for all newborns. Option D. It only applies to life insurance. The correct answer is option A. It prevents insurers from discriminating based on genetic information. This act protects individuals from being treated unfairly by health insurers or employers due to their DNA. Question 24. When a medical provider asks a patient a question that requires a one-word response, what type of question is being used? Option A, direct. Option B, open. Option C, leading. Option D, reflective. The correct answer is option A, direct. Direct questions are used to obtain specific facts quickly. Question 25. According to Maslow's theory of human behavior, which of the following does not describe someone who has achieved self-actualization? Option A, self-centered. Option B, problem-solving. Option C, creative. Option D, accepting of others. The correct answer is option A, self-centered. Self-actualized individuals are characterized by their focus on growth in others rather than being self-centered. Question 26. 4 patients arrive at the emergency room: a gunshot wound in a seizing patient and an asthma attack and a dislocated shoulder. Who is seen last? Option A, shoulder dislocation. Option B, gunshot wound. Option C, seizing patient. Option D, asthma attack. The correct answer is option A, shoulder dislocation. The dislocated shoulder is the least life-threatening compared to the other acute respiratory and neurological emergencies. Question 27. Which of the following is false regarding the Occupational Safety and Health Administration? Option A, employers must provide employees with job benefits and vacation time. Option B, employers must provide a safe workplace. Option C, employers must provide safety training. Option D, employers must provide personal protective equipment. The correct answer is option A. Employers must provide employees with job benefits and vacation time. The Occupational Safety and Health Administration regulates workplace safety but not employee benefits or vacation. Question 28. Which of the following practices is prohibited by the Fair Debt Collection Practices Act? Option A, calling a consumer at 4 in the morning. Option B, calling a consumer at noon. Option C, sending a bill in the mail. Option D, charging interest as agreed in a contract. The correct answer is option A, calling a consumer at 4 in the morning. Debt collectors are legally barred from contacting consumers during unusual or inconvenient times. Question 29. A 5-year-old patient is brought to the emergency room with a broken wrist and bruising clusters. What is the most appropriate initial response? Option A, call Child Protective Services. Option B, ask the child what happened. Option C, treat the wrist and send them home. Option D, give the parent a warning. The correct answer is option A, call Child Protective Services. Medical professionals are mandated reporters and must report any suspicion of child abuse immediately. Question 30. What is the medical term for a woman's first period? Option A. Menarche. Option B. Menopause. Option C. Amenorrhea. Option D. Dysmenorrhea. The correct answer is option A. Menarche. Menarche is the onset of menstruation during puberty. Question 31. A patient is a suspected victim of domestic abuse. Which of the following questions is most inappropriate? Option A. Why do you allow yourself to be abused? Option B. Are you safe at home? Option C. Has anyone hurt you? Option D. Do you need help finding a shelter? The correct answer is option A. Why do you allow yourself to be abused? Victim-blaming questions are unprofessional and can damage the patient's trust and safety. Question 32. Which of the following is not communicated by respiratory droplets? Option A. Hepatitis B. Option B. Influenza. Option C. Pertussis. Option D. Common cold. The correct answer is option A. Hepatitis B. Hepatitis B is transmitted through blood or other body fluids but not through coughing or sneezing droplets. Question 33. Which of the following is a violation of the Health Insurance Portability and Accountability Act? Option A. Keeping yourself logged into the hospital computer to allow quicker documentation. Option B. Using a privacy screen on a monitor. Option C. Shredding sensitive documents. Option D. Speaking in a private room about a patient. The correct answer is option A. Keeping yourself logged into the hospital computer to allow quicker documentation. Leaving a computer session active and unattended allows unauthorized access to protected health information. Question 34. Which of the following best describes universal precautions? Option A. Treating human body fluids as if they contained infectious diseases. Option B. Only wearing gloves for known sick patients. Option C. Recapping needles after use. Option D. Hand washing once a day. The correct answer is option A. Treating human body fluids as if they contained infectious diseases. Universal precautions require healthcare workers to treat all blood and body fluids as potentially infectious. Question 35. Which of the following is the least important piece of information when taking an urgent message? Option A. Address. Option B. Patient name. Option C. A phone number. Option D. A reason for call. The correct answer is option A. Address. While name and contact info are vital, the patient address is usually already on file and not needed for the message itself. Question 36. Which of the following is not a venereal disease? Option A. Varicella. Option B. Chlamydia. Option C. Gonorrhea. Option D. Syphilis. The correct answer is option A. Varicella. Varicella is the virus that causes chickenpox and is not a sexually transmitted infection. Question 37. Which of the following statements regarding the Truth in Lending Act of 1968 is most accurate? Option A. It mandates that the annual percentage rate must be disclosed to the consumer. Option B. It limits interest rates to 5%. Option C. It only applies to mortgage loans. Option D. It forbids credit cards for minors. The correct answer is option A. It mandates that the annual percentage rate must be disclosed to the consumer. The Act ensures that consumers are informed of the true cost of credit, including the annual percentage rate. Question 38. Which medication is the least likely to be investigated by the Drug Enforcement Agency? Option A. Amoxicillin. Option B. Morphine. Option C. Adderall. Option D. Xanax. The correct answer is option A. Amoxicillin. Amoxicillin is an antibiotic and is not a controlled substance with potential for abuse. Question 39. Which of the following conditions is the most dangerous? Option A. Third-degree burn. Option B. First-degree burn. Option C. Second-degree burn. Option D. Sunburn. The correct answer is option A. Third-degree burn. Third-degree burns involve all layers of the skin and can cause permanent damage or life-threatening complications. Question 40. What is the most common blood-borne illness in the United States? Option A. Hepatitis C. Option B, a human immunodeficiency virus. Option C, hepatitis B. Option D, syphilis. The correct answer is option A, hepatitis C. Hepatitis C is currently the most prevalent chronic blood-borne infection in the nation. Question 41. Which of the following classes of medications would not be controlled by the Drug Enforcement Agency? Option A, antibiotics. Option B, opioids. Option C, stimulants. Option D, sedatives. The correct answer is option A, antibiotics. Antibiotics do not have a high potential for addiction and are not classified as controlled substances. Question 42. Which of the following is not a function of the Centers for Disease Control and Prevention? Option A, regulates and supervises vaccines. Option B, tracks disease outbreaks. Option C, provides health information to the public. Option D, researches environmental health. The correct answer is option A, regulates and supervises vaccines. The Food and Drug Administration is responsible for regulating and supervising vaccines while the CDC tracks their efficacy. Question 43. What bodily fluid has the highest risk for transmitting human immunodeficiency virus? Option A, semen. Option B, saliva. Option C, tears. Option D, sweat. The correct answer is option A, semen. Semen contains a much higher concentration of the virus compared to other fluids like saliva or sweat. Question 44. Which situation is the best example of implied consent? Option A, rolling up a sleeve for a blood pressure check. Option B, signing a surgery authorization form. Option C, verbally agreeing to a prescription. Option D, having a power of attorney sign for you. The correct answer is option A, rolling up a sleeve for a blood pressure check. Implied consent is shown through nonverbal actions that indicate a willingness to undergo a procedure. Question 45. What is the best statement that describes an emancipated minor? Option A, a person who is freed from control of their parents. Option B, a minor who is still living at home. Option C, a child who has a part-time job. Option D, a teenager who is attending college. The correct answer is option A, a person who is freed from control of their parents. Emancipated minors have been granted adult legal status and are responsible for their own medical and financial decisions. Question 46. All of the following are within a medical assistant's scope of practice except which one? Option A, performing laceration repair. Option B, changing a dressing. Option C, giving an injection. Option D, performing an electrocardiogram. The correct answer is option A, performing laceration repair. Suturing and repairing lacerations is a provider-level task that falls outside the scope of a medical assistant. Question 47. Which of the following describes the ability to make one's own medical decisions? Option A, capacity. Option B, competence. Option C, compliance. Option D, consistency. The correct answer is option A, capacity. Capacity is the clinical assessment of a patient's ability to understand their health and make informed choices. Question 48. Which of the following is a function of the Food and Drug Administration? Option A, regulates dietary supplements. Option B, tracks seasonal flu cases. Option C, regulates workplace safety. Option D, manages national parks. The correct answer is option A, regulates dietary supplements. The Food and Drug Administration oversees the safety of food and drugs and dietary supplements. Question 49. What is the legal term requiring a patient to appear in court to provide certain documentation? Option A, subpoena duces tecum. Option B, subpoena ad testificandum. Option C, residential ipsa loquitur. Option D, quid pro quo. The correct answer is option A, subpoena duces tecum. This legal writ requires a person to bring physical evidence or records to a court proceeding. Question 50. A physician prescribes a medication to a patient with a known allergy and the patient dies. What type of crime did the physician commit? Option A, negligence. Option B, assault. Option C, battery. Option D, a fraud. The correct answer is option A, negligence. Negligence occurs when a healthcare professional fails to provide the standard of care, resulting in harm. Question 51. According to Erickson's stages of development, which of the following conflicts would not take place during school-age years? Option A, generativity versus stagnation. Option B, industry versus inferiority. Option C, a trust versus mistrust. Option D, identity versus role confusion. The correct answer is option A, generativity versus stagnation. Generativity versus stagnation is a conflict that occurs during middle adulthood. Question 52. Which of the following would be the least helpful when trying to communicate with someone who speaks little English? Option A is speaking slowly in a loud voice. Option B, using an interpreter. Option C, using pictures or diagrams. Option D, avoiding medical jargon. The correct answer is option A, speaking slowly in a loud voice. Shouting does not help a patient understand a different language and can be perceived as aggressive. Question 53. A patient calls demanding to speak to the physician immediately. What is the most important initial question to ask? Option A, what is the issue regarding? Option B, are you a current patient? Option C, what is your insurance? Option D, can you call back later? The correct answer is option A, what is the issue regarding? Triage is necessary to determine the urgency of the situation before involving the physician. Question 54. A physician is accused of molesting a patient while she was under anesthesia. What crime did the physician allegedly commit? Option A, assault. Option B, negligence. Option C, libel. Option D, slander. The correct answer is option A, assault. Assault and battery are the legal terms for unauthorized or harmful physical contact. Question 55. An elderly patient with Alzheimer's disease gives a $50 bill for her $20 copay. What is the most appropriate action? Option A, give the woman $30. Option B, keep the money as a tip. Option C, put the extra $30 toward her next visit. Option D, tell her she did not give you enough. The correct answer is option A, give the woman $30. Medical staff must act ethically and ensure the patient receives the correct change regardless of their cognitive state. Question 56. A woman is diagnosed with chlamydia. What should she be advised to do next? Option A, call previous partners and inform them of her diagnosis. Option B, stop taking her medication once she feels better. Option C, keep the diagnosis a secret. Option D, never have sex again. The correct answer is option A, call previous partners and inform them of her diagnosis. Partner notification is essential to prevent the further spread of sexually transmitted infections. Question 57. A child is brought to the hospital with a second episode of a concussion and a fractured arm. What is the most appropriate initial action? Option A, call Child Protective Services. Option B, treat the injuries and send them home. Option C, wait for the mother to arrive. Option D, tell the father he is doing a bad job. The correct answer is option A, call Child Protective Services. Repeated suspicious injuries in a child require an immediate report to authorities for investigation. Question 58. A patient has a history of verbally abusing the office staff and the physician. What can be done about this patient? Option A, terminate the patient-physician relationship. Option B, refuse to provide any medical records. Option C, call the patient's insurance to complain. Option D, charge the patient a double fee. The correct answer is option A, terminate the patient-physician relationship. Providers have the right to end a relationship with a patient who is abusive or non-compliant. Question 59. Which of the following measures may help prevent workplace accidents? Option A, Hoyer lifts. Option B, high-heeled shoes. Option C, leaving spills on the floor. Option D, using broken equipment. The correct answer is option A, Hoyer lifts. Hoyer lifts and other assistive devices prevent back injuries and falls when moving patients. Question 60. What is the Latin phrase that means without negligence the accident would not have happened? Option A, residential ipsa loquitur. Option B, caveat emptor. Option C, de facto. Option D, habeas corpus. The correct answer is option A, residential ipsa loquitur. Residential ipsa loquitur is a legal doctrine used when the injury itself proves that negligence occurred. Question 61. A patient's sister states she is a physician and wants to see her sister's medical records. What is the most appropriate action? Option A, tell the patient consent must be signed authorizing her sister to view the records. Option B, give her the records because she is a doctor. Option C, allow her to look at the computer screen. Option D, ask her to prove she is a physician. The correct answer is option A. Tell the patient consent must be signed authorizing her sister to view the records. Professional status does not bypass privacy laws and patient consent is always required. Question 62. A medical assistant witnesses a nurse administer the incorrect medication to a patient but there are no negative effects. What should the medical assistant do? Option A, report the incident to administration. Option B, ignore it since the patient is okay. Option C, tell the patient's family. Option D, keep a secret log at home. The correct answer is option A, report the incident to administration. All medication errors must be reported to ensure patient safety and proper institutional review. Question 63. What is the medical term for surgically rerouting the large intestine through an opening in the abdominal wall? Option A, a colostomy. Option B, endoscopy. Option C, appendectomy. Option D, gastrectomy. The correct answer is option A, colostomy. A colostomy creates an artificial opening called a stoma for waste to leave the body. Question 64. What does the suffix itis mean? Option A, inflammation. Option B, pain. Option C, enlargement. Option D, surgical removal. The correct answer is option A, inflammation. The suffix itis is added to anatomical terms to indicate inflammation of that part. Question 65. Which of the following represents structures in the arm? Option A, ulna and radius and olecranon. Option B, femur and tibia and fibula. Option C, sternum and ribs and vertebrae. Option D, carpals and tarsals and phalanges. The correct answer is option A, ulna and radius and olecranon. The ulna and radius are the bones of the forearm and the olecranon is the point of the elbow. Question 66. What is the medical term for the bones that support both sides of the ankle? Option A, malleolus. Option B, patella. Option C, calcaneus. Option D, tarsal. The correct answer is option A, malleolus. The malleolus refers to the bony prominences on either side of the ankle joint. Question 67. Which of the following is not superior to the acetabulum? Option A, patella. Option B, clavicle. Option C, cranium. Option D, sternum. The correct answer is option A, patella. The patella or kneecap is located inferior to the acetabulum, which is the hip socket. Question 68. What does the suffix acousis mean? Option A, hearing. Option B, a vision. Option C, a smell. Option D, touch. The correct answer is option A, hearing. This suffix is used in terms related to hearing disorders such as presbyacusis. Question 69. A medical assistant hears that a stroke patient is aphasic. What type of deficit does this patient have? Option A, difficulty with speech. Option B, inability to walk. Option C, loss of vision. Option D, difficulty swallowing. The correct answer is option A, difficulty with speech. Aphasia is a communication disorder that results from damage to the portions of the brain that contain language. Question 70. A patient with cervical cancer should be referred to which specialist? Option A, gynecologist. Option B, dermatologist. Option C, urologist. Option D, cardiologist. The correct answer is option A, gynecologist. Gynecologists specialize in the health of the female reproductive system, including the cervix. Question 71. Which of the following should be worn at all times when doing procedures? Option A, gloves. Option B, sunglasses. Option C, a tie. Option D, a watch. The correct answer is option A, gloves. Gloves are an essential part of personal protective equipment to prevent the transmission of pathogens. Question 72. Which of the following subjects should not be on office memos? Option A, arguments among staff. Option B, meeting times. Option C, policy changes. Option D, holiday hours. The correct answer is option A, arguments among staff. Office memos should remain professional and should not be used for airing personal grievances. Question 73. A patient has a torn meniscus. Which type of procedure is needed? Option A, arthroscopy. Option B, colonoscopy. Option C, laparoscopy. Option D, thoracoscopy. The correct answer is option A, arthroscopy. Arthroscopy is a minimally invasive surgical procedure on a joint using an endoscope. Question 74. What is the term for the method of keeping track of office supplies? Option A, inventory. Option B, billing. Option C, accounting. Option D, a triage. The correct answer is option A, inventory. Inventory management ensures that a medical office always has the necessary supplies for patient care. Question 75. What is the medical term for the breastplate? Option A, a sternum. Option B, scapula. Option C, clavicle. Option D, humerus. The correct answer is option A, sternum. The sternum is the flat bone located in the center of the chest. Question 76. When would it be most appropriate to first send an unpaid bill to a collection agency? Option A, 3 months. Option B, 1 week. Option C, 2 years. Option D, immediately. The correct answer is option A, 3 months. Most medical offices wait 90 days before turning an account over to a collection agency. Question 77. A patient with Crohn's disease should be referred to which specialist? Option A, gastroenterologist. Option B, endocrinologist. Option C, neurologist. Option D, pulmonologist. The correct answer is option A, gastroenterologist. Gastroenterologists treat disorders of the digestive system, including inflammatory bowel diseases. Question 78. Which of the following represents structures in the abdominal cavity? Option A, kidneys and duodenum and pancreas and stomach. Option B, lungs and heart and esophagus. Option C, brain and spinal cord. Option D, bladder and reproductive organs. The correct answer is option A, kidneys and duodenum and pancreas and stomach. The kidneys and stomach and other digestive organs are located within the abdomen. Question 79. Which of the following is the most appropriate use of petty cash? Option A, manila folders. Option B, office rent. Option C, staff salaries. Option D, medical equipment. The correct answer is option A, manila folders. Petty cash is intended for small and inexpensive office needs rather than major expenses. Question 80. A patient with psoriasis should be referred to which specialist? Option A, dermatologist. Option B, allergist. Option C, pediatrician. Option D, surgeon. The correct answer is option A, dermatologist. Dermatologists specialize in treating conditions of the skin and hair and nails. Question 81. Who would not be eligible for the Civilian Health and Medical Program of the Department of Veterans Affairs? Option A, a child of a disabled veteran released from service for misconduct. Option B, a spouse of a veteran with a permanent disability. Option C, a survivor of a veteran who died in the line of duty. Option D, A child of a veteran who died from a service-connected disability. The correct answer is option A. A child of a disabled veteran released from service for misconduct. Benefits are generally denied to dependents of veterans who did not receive an honorable discharge. Question 82. Which of the following patients is most appropriate for TRICARE? Option A. A Marine. Option B. A retired teacher. Option C. A corporate executive. Option D. A foreign tourist. The correct answer is option A. A Marine. TRICARE is the healthcare program for uniformed service members and their families. Question 83. Which of the following structures are not inside the thoracic cavity? Option A. Duodenum. Option B. Heart. Option C. Lungs. Option D. Esophagus. The correct answer is option A. Duodenum. The duodenum is part of the small intestine located in the abdominal cavity. Question 84. What structure is lateral to the liver? Option A. A spleen. Option B. Heart. Option C. A bladder. Option D. Lungs. The correct answer is option A. Spleen. The spleen is located on the opposite side of the upper abdomen from the liver. Question 85. What structure is ventral to the lungs? Option A. A sternum. Option B. A spine. Option C. Kidneys. Option D. Diaphragm. The correct answer is option A. Sternum. Ventral means toward the front, so the sternum sits in front of the lungs. Question 86. Which of the following pairs is separated by a transverse plane? Option A. Head and feet. Option B. Right arm and left arm. Option C. A front of chest and back. Option D. Left eye and right eye. The correct answer is option A. Head and feet. A transverse plane divides the body into upper and lower or superior and inferior sections. Question 87. Where is the malleolus in relation to the femur? Option A. Inferior. Option B. Superior. Option C. Medial. Option D. Lateral. The correct answer is option A. Inferior. The malleolus is at the ankle, which is much lower than the femur or thigh bone. Question 88. What structure is not inferior to the kidney? Option A. Adrenal gland. Option B. Bladder. Option C. Ureter. Option D. Urethra. The correct answer is option A. Adrenal gland. The adrenal glands sit directly on top of the kidneys, making them superior. Question 89. Which system provides support and movement to the body? Option A. Musculoskeletal. Option B. Respiratory. Option C. Digestive. Option D. Integumentary. The correct answer is option A. Musculoskeletal. The musculoskeletal system includes all bones and muscles that allow the body to maintain its shape and move. Question 90. How many stages are in the chain of infection? Option A. 6. Option B. 3. Option C. 10. Option D. 4. The correct answer is option A. 6. The 6 links include the infectious agent and reservoir and portal of exit and mode of transmission and portal of entry and susceptible host. Question 91. Which of the following would be considered the best type of susceptible host for infection to spread? Option A. A patient with Hodgkin lymphoma. Option B. A healthy teenager. Option C. A person with a strong immune system. Option D. A vaccinated adult. The correct answer is option A. A patient with Hodgkin lymphoma. Immunocompromised individuals like those with lymphoma are much more likely to contract infections. Question 92. Which system would be most affected by pyelonephritis? Option A. Urinary. Option B. Cardiovascular. Option C. Nervous. Option D. Skeletal. The correct answer is option A. Urinary. Pyelonephritis is a type of kidney infection that falls under the urinary system. Question 93. What organism needs a host to survive? Option A. Parasite. Option B, bacteria. Option C, fungi. Option D, mold. The correct answer is option A, parasite. Parasites live on or in a host organism and get their food from or at the expense of their host. Question 94. Which of the following is not a shared characteristic between viruses and bacteria? Option A, they contain cell walls. Option B, they can cause disease. Option C, they can be transmitted between people. Option D, they contain genetic material. The correct answer is option A, they contain cell walls. Bacteria have cell walls, but viruses consist of genetic material encased in a protein coat without a cell wall. Question 95. A mistake is made while writing a progress note. What is the most appropriate course of action? Option A, cross out the error once and initial it. Option B, use whiteout to cover it. Option C, scribble over it until it is unreadable. Option D, rip up the page and start over. The correct answer is option A, cross out the error once and initial it. Legal medical documentation requires that errors be corrected transparently without hiding the original entry. Question 96. Where are the mammary glands in relation to the spine? Option A, ventral. Option B, dorsal. Option C, superior. Option D, inferior. The correct answer is option A, ventral. The mammary glands are on the front of the body while the spine is on the back. Question 97. Which represents a normal heart rate in an adult human? Option A, 60 beats per minute. Option B, 20 beats per minute. Option C, 150 beats per minute. Option D, 200 beats per minute. The correct answer is option A, 60 beats per minute. A resting heart rate between 60 and 100 beats per minute is considered normal. Question 98. Where is the appendix located in a non-pregnant person with typical anatomy? Option A, right lower quadrant. Option B, left lower quadrant. Option C, right upper quadrant. Option D, left upper quadrant. The correct answer is option A, right lower quadrant. The appendix is found in the lower right portion of the abdomen. Question 99. Which represents a normal pulse oximetry reading on room air? Option A, 100%. Option B, 70%. Option C, 50%. Option D, 85%. The correct answer is option A, 100%. A healthy oxygen saturation level is typically between 95 and 100%. Question 100. Which system would be most affected by leukemia? Option A, hematologic. Option B, digestive. Option C, respiratory. Option D, integumentary. The correct answer is option A, hematologic. Leukemia is a cancer of the body's blood-forming tissues including the bone marrow and the lymphatic system. Question 101. In regard to the chain of infection, which would not be a portal of entry? Option A, perspiration. Option B, the nose. Option C, the mouth. Option D, an open wound. The correct answer is option A, perspiration. Sweat is generally not a route for pathogens to enter the body. Question 102. What is not a likely location for pulse oximeter placement? Option A, sublingual. Option B, finger. Option C, toe. Option D, beer lobe. The correct answer is option A, sublingual. Pulse oximeters require a translucent area with good blood flow, which does not include the area under the tongue. Question 103. What is the average body temperature in a human in Fahrenheit? Option A, 98.6 degrees. Option B, 95 degrees. Option C, 101 degrees. Option D, 97 degrees. The correct answer is option A, 98.6 degrees. 98.6 is widely considered the standard average core temperature. Question 104. What is a common spot to palpate a pulse during a routine office visit? Option A, radial artery. Option B, femoral artery. Option C, popliteal artery. Option D, dorsalis pedis. The correct answer is option A, radial artery. The radial artery at the wrist is the most accessible and common site for pulse checks. Question 105. Which system would be most affected by celiac disease? Option A, gastrointestinal. Option B, neurological. Option C, reproductive. Option D is skeletal. The correct answer is option A, gastrointestinal. Celiac disease is an immune reaction to eating gluten that primarily damages the small intestine. Question 106. Which of the following statements belongs in the chief complaint section of a progress note? Option A, abdominal pain for 5 days. Option B, patient is a non-smoker. Option C, mother has high blood pressure. Option D, heart rate is 72. The correct answer is option A, abdominal pain for 5 days. The chief complaint is the primary reason the patient is seeking medical attention in their own words. Question 107. Fungi would commonly be found in which location? Option A, mold. Option B, bacteria. Option C, viruses. Option D, parasites. The correct answer is option A, mold. Mold is a type of fungus that grows in multicellular filaments. Question 108. In regard to the chain of infection, which best represents a reservoir? Option A, soil. Option B, a virus. Option C, a sneeze. Option D, a syringe. The correct answer is option A, soil. A reservoir is the habitat in which an infectious agent normally lives and grows. Question 109. Which of the following items should be sterilized in an autoclave? Option A, surgical instruments. Option B, stethoscopes. Option C, blood pressure cuffs. Option D, exam tables. The correct answer is option A, surgical instruments. Reusable items that penetrate sterile tissue must be autoclaved to ensure all microbes are destroyed. Question 110. Which system would be most affected by endometriosis? Option A, reproductive. Option B, urinary. Option C, respiratory. Option D is circulatory. The correct answer is option A, reproductive. Endometriosis is a disorder where tissue similar to the lining of the uterus grows outside the uterus. Question 111. What position is a patient in when he or she is lying face down? Option A, prone. Option B, supine. Option C, lateral. Option D is Sims. The correct answer is option A, prone. The prone position is used for examinations of the back and certain procedures. Question 112. At what age should most patients get their first colonoscopy? Option A, 50 years old. Option B, 20 years old. Option C, 80 years old. Option D, 35 years old. The correct answer is option A, 50 years old. Screening for colorectal cancer typically begins at age 50 for average risk individuals. Question 113. How often should a woman perform a breast exam? Option A, monthly. Option B, daily. Option C, yearly. Option D, every 5 years. The correct answer is option A, monthly. Regular monthly self-exams help women become familiar with the normal feel of their breasts. Question 114. What position is a patient in when he or she is lying flat on his or her back with his or her head tilted downward? Option A, a Trendelenburg. Option B, Fowler's. Option C, lithotomy. Option D, prone. The correct answer is option A, Trendelenburg. The Trendelenburg position is often used to treat hypotension or during certain abdominal surgeries. Question 115. A patient with hypertension should limit which of the following? Option A, sodium. Option B, protein. Option C, calcium. Option D, a vitamin C. The correct answer is option A, Sodium. High salt intake causes the body to retain fluid, which increases blood pressure. Question 116. Which of the following laboratory values evaluates blood viscosity and clotting time? Option A, international normalized ratio. Option B, glucose. Option C, cholesterol. Option D, sodium. The correct answer is option A, international normalized ratio. The international normalized ratio is used to monitor patients on blood-thinning medications. Question 117. Which of the following lab values monitors kidney function? Option A, creatinine. Option B, hemoglobin. Option C, amylase. Option D, lipase. The correct answer is option A, creatinine. Creatinine is a waste product filtered by the kidneys, and high levels can indicate impaired function. Question 118. A patient with celiac disease should avoid which of the following? Option A, crackers. Option B, apples. Option C, chicken. Option D, milk. The correct answer is option A, crackers. Most crackers are made from wheat, which contains the gluten that triggers celiac symptoms. Question 119. Helicobacter pylori is responsible for which of the following? Option A, gastritis. Option B, pneumonia. Option C, strep throat. Option D, urinary tract infection. The correct answer is option A, gastritis. This bacterium is a major cause of stomach inflammation and peptic ulcers. Question 120. Which of the following should be limited or avoided in a patient with lactose intolerance? Option A, cheese. Option B, bread. Option C, oranges. Option D, steak. The correct answer is option A, cheese. Dairy products like cheese contain lactose, which the patient cannot properly digest. Question 121. A patient's occupation should be in which section of the progress note? Option A, social history. Option B, chief complaint. Option C, review of systems. Option D, family history. The correct answer is option A, social history. Social history includes lifestyle factors such as work and habits and living situation. Question 122. When is the best time for a patient blood pressure to be taken during an office visit? Option A, after sitting in a chair for several minutes. Option B, immediately after walking into the room. Option C, while the patient is talking. Option D, after the physical exam is finished. The correct answer is option A, after sitting in a chair for several minutes. A period of rest ensures that the reading is a true baseline and not elevated by physical activity. Question 123. Which of the following is a normal respiratory rate in a healthy adult? Option A, 16 breaths per minute. Option B, 8 breaths per minute. Option C, 30 breaths per minute. Option D, 50 breaths per minute. The correct answer is option A, 16 breaths per minute. The typical adult respiratory rate is between 12 and 20 breaths per minute. Question 124. Which of the following is not needed for suture removal? Option A, skin glue. Option B, scissors. Option C, forceps. Option D, antiseptic wipes. The correct answer is option A, skin glue. Skin glue is used for wound closure but not for the removal of existing sutures. Question 125. Which of the following is the best technique for prepping the skin prior to a procedure? Option A, make gradually enlarging circles around the future incision site. Option B, rub back and forth vigorously. Option C, wipe only the center of the site. Option D, a scrub in a square pattern. The correct answer is option A, make gradually enlarging circles around the future incision site. Cleaning from the center outward in circles prevents dragging bacteria back into the sterile field. Question 126. Through which route is insulin administered? Option A, subcutaneous. Option B, intramuscular. Option C, intravenous. Option D, oral. The correct answer is option A, subcutaneous. Insulin is injected into the fatty tissue layer just below the skin for slow absorption. Question 127. How often should a poorly controlled diabetic check their sugars? Option A, before meals and at bedtime. Option B, once a week. Option C, every hour. Option D, only when they feel sick. The correct answer is option A, before meals and at bedtime. Frequent monitoring is necessary to adjust insulin and diet for stable glucose levels. Question 128. Which of the following is not a direct result of tobacco use? Option A, diabetes. Option B, lung cancer. Option C, emphysema. Option D, heart disease. The correct answer is option A, diabetes. While tobacco worsens health, diabetes is a metabolic disorder and not a direct outcome of smoking. Question 129. Through which route is the influenza vaccine usually administered? Option A, intramuscular. Option B, subcutaneous. Option C, intradermal. Option D, oral. The correct answer is option A, intramuscular. Most flu shots are delivered into the deltoid muscle of the upper arm. Question 130. How often should women ages 21 to 65 have pap smears? Option A, every 3 years. Option B, every 10 years. Option C, every 6 months. Option D, only if they have symptoms. The correct answer is option A, every 3 years. Regular screening is vital for the early detection of cervical cancer. Question 131. Which of the following should receive the measles, mumps, and rubella vaccination? Option A, a patient with diabetes. Option B, a pregnant woman. Option C, a patient with a severely suppressed immune system. Option D, an infant under 6 months old. The correct answer is option A, a patient with diabetes. Diabetes is not a contraindication for this vaccine, unlike pregnancy or severe immunodeficiency. Question 132. What type of fracture involves a bend and a crack of the bone? Option A, green stick. Option B, compound. Option C, comminuted. Option D is stress. The correct answer is option A, green stick. Green stick fractures occur most often in children whose bones are softer and more flexible. Question 133. What is the most common type of stroke? Option A, ischemic. Option B, hemorrhagic. Option C, transient. Option D, embolic. The correct answer is option A, ischemic. Ischemic strokes are caused by a blockage in an artery that supplies blood to the brain. Question 134. Which of the following is not a treatment for poisoning? Option A, antibiotics. Option B, activated charcoal. Option C, stomach pumping. Option D, antidotes. The correct answer is option A, antibiotics. Antibiotics treat bacterial infections and are not used to neutralize or remove toxins. Question 135. Which of the following best describes an absence seizure? Option A, blank staring. Option B, a generalized shaking. Option C, falling to the ground. Option D, a violent outbursts. The correct answer is option A, blank staring. Absence seizures involve brief and sudden lapses in consciousness without physical convulsions. Question 136. What is the treatment for diabetic ketoacidosis? Option A, insulin. Option B, glucose. Option C, antibiotics. Option D, sedatives. The correct answer is option A, insulin. Diabetic ketoacidosis is a life-threatening complication of high blood sugar that requires insulin and fluids. Question 137. Which best defines an oblique fracture? Option A, a diagonal fracture. Option B, a horizontal fracture. Option C, a vertical fracture. Option D, a shattered bone. The correct answer is option A, a diagonal fracture. An oblique fracture is one that occurs at an angle across the bone. Question 138. A right-sided stroke will most likely affect which part of the body? Option A, left arm. Option B, right arm. Option C, both legs. Option D, the face only. The correct answer is option A, left arm. The brain controls the opposite side of the body, so a right hemisphere stroke affects the left side. Question 139. What radiological study is the best choice to evaluate a joint dislocation? Option A, X-ray. Option B, ultrasound. Option C, magnetic resonance imaging. Option D, computed tomography. The correct answer is option A, X-ray. X-rays are the standard and fastest way to visualize bone alignment and displacement. Question 140. What is the medical term for passing out? Option A, syncope. Option B, a vertigo. Option C, ataxia. Option D, apnea. The correct answer is option A, syncope. Syncope is a temporary loss of consciousness usually related to insufficient blood flow to the brain. Question 141. What is the medical term for gait dysfunction? Option A, ataxia. Option B, aphasia. Option C, dysphagia. Option D, apraxia. The correct answer is option A, ataxia. Ataxia is a lack of muscle coordination which can affect speech and eye movements and walking. Question 142. What is the medical term for an abnormal high-pitched whistling sound made while breathing? Option A, a wheezing. Option B, a stridor. Option C, harals. Option D, ronchi. The correct answer is option A, wheezing. Wheezing is typically caused by narrowed airways as seen in asthma or allergies. Question 143. Which of the following would be treated by an automated external defibrillator? Option A, a ventricular fibrillation. Option B, heartburn. Option C, high blood pressure. Option D, migraine. The correct answer is option A, ventricular fibrillation. An automated external defibrillator delivers a shock to restore a normal heart rhythm during cardiac arrest. Question 144. Which of the following best describes a grand mal seizure? Option A, generalized tremors. Option B, focal twitching. Option C, numbness in the legs. Option D, sudden sleepiness. The correct answer is option A, generalized tremors. Grand mal or tonic-clonic seizures involve loss of consciousness and violent muscle contractions. Question 145. If there is a question regarding a vaccine expiration date, what would be the most appropriate action? Option A, throw it away. Option B, use it anyway. Option C, wait for the doctor to check. Option D, put it back in the fridge. The correct answer is option A, throw it away. Safety is the priority and expired or questionable medications should never be administered. Question 146. Which of the following best describes a simple partial seizure? Option A, focal tremors. Option B, loss of consciousness. Option C, generalized shaking. Option D, total paralysis. The correct answer is option A, focal tremors. Simple partial seizures affect only a small part of the brain and do not cause a loss of consciousness. Question 147. Which of the following is not part of the 6 rights of medication administration? Option A, right consent. Option B, right patient. Option C, right dose. Option D, right route. The correct answer is option A, right consent. The 6 rights are patient and drug and dose and route and time and documentation. Consent is a separate legal requirement. Question 148. Which of the following is not a severe complication of hemorrhage? Option A, diabetes insipidus. Option B, shock. Option C, organ failure. Option D, death. The correct answer is option A, diabetes insipidus. Diabetes insipidus is a hormonal disorder unrelated to acute blood loss or hemorrhage. Question 149. What is the medical term for a respiratory rate of 32 breaths per minute? Option A, tachypnea. Option B, bradypnea. Option C, apnea. Option D, eupnea. The correct answer is option A, tachypnea. Tachypnea is the term for rapid breathing defined as a rate above the normal range. Question 150. A medication needs to be taken under the tongue. What is the medical term for this? Option A, sublingual. Option B, oral. Option C, transdermal. Option D, buccal. The correct answer is option A, sublingual. Sublingual administration allows the medication to dissolve and enter the bloodstream through the tissues under the tongue. Question 151. All of the following items are typically found in a crash cart except which one? Option A, a stethoscope. Option B, defibrillator. Option C, emergency medications. Option D, oxygen tank. The correct answer is option A, a stethoscope. While vital in an office, a stethoscope is usually carried by the clinician rather than stored inside the crash cart. Question 152. Which of the following is the most severe type of drug reaction? Option A, anaphylaxis. Option B, nausea. Option C, hives. Option D, headache. The correct answer is option A, anaphylaxis. Anaphylaxis is a life-threatening allergic reaction that requires immediate medical intervention. Question 153. Which of the following is the best way to assess the responsiveness of a patient? Option A, a tap on his or her chest and ask if he or she is awake. Option B, a splash water on their face. Option C, check their blood pressure. Option D, wait for 10 minutes. The correct answer is option A, tap on his or her chest and ask if he or she is awake. Physical and verbal stimulation is the standard first step in assessing an unconscious person. Question 154. What is the most common concern with feral animal bites? Option A, rabies. Option B, diabetes. Option C, influenza. Option D, high blood pressure. The correct answer is option A, rabies. Rabies is a viral disease transmitted through the saliva of infected animals and is a major medical concern. Question 155. According to Advanced Cardiac Life Support Protocol, how many chest compressions should be performed in a minute? Option A, 100. Option B, 50. Option C, 200. Option D, 10. The correct answer is option A, 100. A rate of 100 to 120 compressions per minute is required to maintain circulation. Question 156. Where is the best location to assess a pulse in an unresponsive patient? Option A, carotid. Option B, radial. Option C, brachial. Option D, dorsalis pedis. The correct answer is option A, carotid. The carotid artery in the neck is the most reliable site to check for a pulse in an emergency. Question 157. Which of the following is not a symptom of vertigo? Option A, seizure. Option B, dizziness. Option C, nausea. Option D, loss of balance. The correct answer is option A, seizure. Vertigo is a sensation of spinning or tilting but does not cause neurological seizures. Question 158. When should a person stop administering the Heimlich maneuver? Option A, when a patient becomes unconscious. Option B, after 5 tries. Option C, when the patient starts crying. Option D, when the patient asks you to stop. The correct answer is option A, when a patient becomes unconscious. If the patient loses consciousness, the rescuer must transition to cardiopulmonary resuscitation. Question 159. Which of the following categories of medications can be safely used during pregnancy? Option A, pregnancy category A. Option B, pregnancy category X. Option C, pregnancy category D. Option D, pregnancy category C. The correct answer is option A, pregnancy category A. Category A drugs have failed to demonstrate a risk to the fetus in the first trimester and are considered safe. Question 160. Who can perform cardiopulmonary resuscitation? Option A. Anyone who has passed a certification course. Option B. Only doctors. Option C. Only nurses. Option D. Only police officers. The correct answer is option A. Anyone who has passed a certification course. Any individual trained and certified in cardiopulmonary resuscitation can provide life-saving aid. Question 161. Which of the following evaluates for potential dermal allergic reactions? Option A. A scratch test. Option B. Blood test. Option C. The urinalysis. Option D. Biopsy. The correct answer is option A. Scratch test. The scratch or skin prick test involves placing a small amount of allergen on the skin to see if a reaction occurs. Question 162. A woman's serum beta-human chorionic gonadotropin is 52 milli-international units per milliliter. What is the status of the pregnancy? Option A. Unknown. Option B. Normal. Option C. Ectopic. Option D. Miscarriage. The correct answer is option A. Unknown. A single lab value cannot determine the health of a pregnancy and must be followed with serial testing. Question 163. Which of the following labs helps monitor inflammation? Option A. Erythrocyte sedimentation rate. Option B. Glucose. Option C. Cholesterol. Option D. A hemoglobin. The correct answer is option A. Erythrocyte sedimentation rate. The erythrocyte sedimentation rate measures how quickly red blood cells sink, which increases during inflammation. Question 164. An Epstein-Barr virus causes which of the following diseases? Option A. Mononucleosis. Option B. Tetanus. Option C. Mumps. Option D. Polio. The correct answer is option A. Mononucleosis. Mononucleosis is a contagious disease most commonly caused by the Epstein-Barr virus. Question 165. Spontaneous bleeding is caused by which of the following conditions? Option A. Thrombocytopenia. Option B. Anemia. Option C. Leukocytosis. Option D. Hypertension. The correct answer is option A. Thrombocytopenia. Thrombocytopenia is a low platelet count which prevents the blood from clotting properly. Question 166. What is the most common method for evaluating potential dermal allergic reactions? Option A. Intradermal. Option B. Oral. Option C. Intravenous. Option D. Inhalation. The correct answer is option A. Intradermal. Intradermal testing involves injecting a tiny amount of allergen just below the skin surface. Question 167. Which of the following means to adjust a measuring device for accuracy? Option A. Calibration. Option B. Sterilization. Option C. Sanitization. Option D. Auscultation. The correct answer is option A. Calibration. Calibration ensures that medical equipment provides correct and reliable readings. Question 168. Which of the following means to preserve or stabilize something for examination? Option A. Fixative. Option B. Antiseptic. Option C. Antibiotic. Option D. Catalyst. The correct answer is option A. Fixative. A fixative is a chemical substance used to preserve a specimen of biological tissue from decay. Question 169. Where would the corpus callosum be located? Option A. Brain. Option B. Heart. Option C. Lungs. Option D. Liver. The correct answer is option A. Brain. The corpus callosum is a large bundle of nerve fibers that connects the two hemispheres of the brain. Question 170. Which test is used to identify hearing threshold levels? Option A. Pure tone audiometry. Option B. Spirometry. Option C. Electrocardiogram. Option D. Visual acuity test. The correct answer is option A. Pure tone audiometry. Audiometry measures the quietest sounds a person can hear at different frequencies. Question 171. In a 12-lead electrocardiogram, how many precordial chest leads are there? Option A, 6. Option B, 12. Option C, 3. Option D, 10. The correct answer is option A, 6. The 6 precordial leads are labeled V1 through V6 and are placed directly on the chest. Question 172. What is the primary purpose of a Holter monitor? Option A, evaluate for arrhythmias. Option B, measure lung capacity. Option C, check blood pressure. Option D, monitor blood sugar. The correct answer is option A, evaluate for arrhythmias. A Holter monitor is a wearable device that records the heart's electrical activity over an extended period. Question 173. A heart rate of 125 beats per minute with irregular P waves describes what? Option A, atrial fibrillation. Option B, bradycardia. Option C, normal sinus rhythm. Option D, a ventricular tachycardia. The correct answer is option A, atrial fibrillation. Atrial fibrillation is an irregular and often rapid heart rate that causes poor blood flow. Question 174. What part of the heart acts as a backup pacemaker? Option A, atrioventricular node. Option B, sinoatrial node. Option C, bundle of His. Option D, aorta. The correct answer is option A, atrioventricular node. If the sinoatrial node fails, the atrioventricular node can take over to maintain the heart rate. Question 175. Which of the following reflects a normal QRS complex duration? Option A is 0.08 seconds. Option B is 0.5 seconds. Option C, 1 full second. Option D, 2 seconds. The correct answer is option A, 0.08 seconds. The QRS complex should normally last between 0.06 and 0.10 seconds. Question 176. Which of the following cannot be detected by a 12-lead electrocardiogram? Option A, vegetation. Option B, arrhythmia. Option C, heart attack. Option D, heart block. The correct answer is option A, vegetation. An electrocardiogram shows electrical activity but cannot see physical growths or vegetation on heart valves. Question 177. Which of the following reflects a PR interval seen with first-degree heart block? Option A is 0.24 seconds. Option B is 0.10 seconds. Option C is 0.05 seconds. Option D is 0.15 seconds. The correct answer is option A, 0.24 seconds. A PR interval greater than 0.20 seconds indicates a delay in electrical conduction. Question 178. A Jaeger card is used to assess which of the following? Option A, vision. Option B, hearing. Option C, reflexes. Option D, balance. The correct answer is option A, vision. The Jaeger card is used specifically to test near vision or the ability to read close up. Question 179. Increased ocular pressure is seen with which of the following pathologies? Option A, glaucoma. Option B, cataracts. Option C, conjunctivitis. Option D, eye. The correct answer is option A, glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve, often due to high pressure. Question 180. Which of the following best describes first-degree heart block? Option A, a constant prolonged PR interval. Option B, a missing QRS complex. Option C, a rapid heart rate. Option D, the irregular P waves. The correct answer is option A, a constant prolonged PR interval. In first-degree block, every impulse reaches the ventricles, but there is a consistent delay. Question 181. Which of the following is a normal respiration rate per minute for a 3-month-old infant? Option A, 30 to 60. Option B, 10 to 12. Option C, 80 to 100. Option D, 60 to 80. The correct answer is option A, 30 to 60. Infants have much faster breathing rates than adults. Question 182. Which code is used for durable medical equipment such as walkers? Option A, D. Option B, A. Option C, J. Option D, L. The correct answer is option A, E. Healthcare Common Procedure Coding System Level 2 codes starting with E designate durable medical equipment. Question 183. Which of the following should be reported as a patient safety variance? Option A. A patient had an allergic reaction to a prescribed medication. Option B. A patient arrived early for an appointment. Option C. A doctor changed a medication dose. Option D. The office ran out of bandages. The correct answer is option A. A patient had an allergic reaction to a prescribed medication. Any adverse event or medication reaction must be documented for patient safety monitoring. Question 184. If a patient no longer wants his records released to another provider, what action is required? Option A. The patient must submit a revocation in writing. Option B. The patient can just tell the receptionist. Option C. The doctor must decide. Option D. The insurance company must be called. The correct answer is option A. The patient must submit a revocation in writing. Privacy laws require that any change to a records release authorization be documented in writing. Question 185. A type 1 diabetic exhibits confusion and rapid heart rate and jumbled speech. What is the cause? Option A, insulin shock. Option B, high blood pressure. Option C, dehydration. Option D, lack of sleep. The correct answer is option A, insulin shock. Insulin shock or severe hypoglycemia happens when blood sugar drops to dangerously low levels. Question 186. Which piece of personal protective equipment is necessary for all routine wound care? Option A, gloves. Option B, face shield. Option C, gown. Option D, goggles. The correct answer is option A, gloves. Gloves are the primary barrier used to prevent contact with blood and infectious materials. Question 187. If a tube of blood breaks on the floor, how long should the area be avoided before cleaning? Option A, 30 minutes. Option B, 1 minute. Option C, 5 hours. Option D, 10 seconds. The correct answer is option A, 30 minutes. Waiting allows any infectious aerosols created by the spill to settle before cleaning begins. Question 188. For a pap smear, in which position should a patient be placed? Option A, lithotomy. Option B, prone. Option C, supine. Option D is Sims. The correct answer is option A, lithotomy. The lithotomy position involves the patient lying on their back with feet in stirrups for pelvic examination. Question 189. A patient is a kinesthetic learner. What is the best approach to use when teaching them to use a glucometer? Option A, provide hands-on practice. Option B, give them a book to read. Option C, show them a video. Option D, lecture them for an hour. The correct answer is option A, provide hands-on practice. Kinesthetic learners understand best by performing the physical task themselves. Question 190. Which of the following is the most appropriate approach when doing telephone screening or triage? Option A, utilize a script. Option B, wing it based on memory. Option C, ask the patient to call back later. Option D, put everyone on hold. The correct answer is option A, utilize a script. Standardized scripts ensure that all necessary safety questions are asked consistently. Question 191. Which part of the chain of infection refers to direct or indirect contact? Option A, mode of transmission. Option B, a reservoir. Option C, susceptible host. Option D, portal of exit. The correct answer is option A, Mode of transmission. Mode of transmission describes how the infectious agent travels from one person to another. Question 192. Before glucose testing, what should be done with the reagent strip? Option A, check the expiration date. Option B, wash it with soap. Option C, cut it in half. Option D, warm it in the microwave. The correct answer is option A, check the expiration date. Expired strips can provide inaccurate results which can lead to dangerous dosing errors. Question 193. What is the best resource for safety precautions for handling and storing certain chemicals? Option A, safety data sheets. Option B, the local newspaper. Option C, a medical dictionary. Option D, an anatomy textbook. The correct answer is option A, safety data sheets. Safety data sheets provide comprehensive information about chemical hazards and safety measures. Question 194. An older male patient has difficulty urinating. Hyperplasia of which organ is likely the cause? Option A, prostate. Option B, bladder. Option C, kidney. Option D, liver. The correct answer is option A, prostate. Benign prostatic hyperplasia is a common condition in aging men that obstructs urine flow. Question 195. When screening distance visual acuity with a Snellen chart, how far away should the patient stand? Option A, 20 feet. Option B, 5 feet. Option C, 50 feet. Option D, 10 feet. The correct answer is option A, 20 feet. Standard visual acuity tests are calibrated for a distance of 20 feet. Question 196. Which of the following is a writ requiring a person to attend court and bring documents? Option A, subpoena duces tecum. Option B, subpoena ad testificandum. Option C, habeas corpus. Option D, amicus curiae. The correct answer is option A, subpoena duces tecum. This legal document specifically commands the production of records or evidence. Question 197. What is the correct response if a patient exhibits signs of shock like cool, clammy skin? Option A, lay the patient flat and elevate the legs. Option B, have them sit in a chair. Option C, give them a glass of water. Option D, ask them to walk around. The correct answer is option A, lay the patient flat and elevate the legs. Elevating the legs helps increase blood flow back to the heart and brain. Question 198. Which of the following measures is included in identity theft protection? Option A, earphones are used when listening to messages. Option B, reading names out loud in the lobby. Option C, leaving charts on the counter. Option D, sharing passwords with co-workers. The correct answer is option A. Earphones are used when listening to messages. Using earphones prevents others in the office from hearing sensitive patient information. Question 199. At what angle to the skin should a needle be inserted for an intradermal injection? Option A, 5 to 15 degrees. Option B, 45 degrees. Option C, 90 degrees. Option D, 30 degrees. The correct answer is option A, 5 to 15 degrees. Intradermal injections are given just below the surface of the skin at a very shallow angle. Question 200. A certified medical assistant tells a combative patient that they will be held down if they do not cooperate. What is this? Option A, assault. Option B, battery. Option C, negligence. Option D, fraud. The correct answer is option A, assault. Assault is the intentional act of making someone fear that they will be harmed or touched without consent.